I'm the Director of Nursing at the Scioto County Health Department. I've been in public health for 13 years. I was first at the Portsmouth City Health Department and came to the County Health Department 5 years ago.
Okay, so you know a lot about what's going on health-wise in the county.
Yeah.
So that's what we're going to talk about. So let me just ask you to start with, when you hear the word diabetes, what do you think of?
I think probably one of the first things I think of, we were talking about prevention, is that it is pretty much a preventable disease in most cases, in a lot of cases. And I think that's probably what comes to mind.
And people don't always think about that.
No, they don't.
You know, in your experience, do you find that people are aware that this disease can be prevented?
You know, I think people are aware, but I think a lot of times people think it won't happen to them until they start seeing some of the early warning signs. I mean, if a physician points that out to them. Otherwise, I think that people in general think it won't happen to me.
Yeah, I think you're absolutely right. Tell me a little bit about your personal experience with diabetes.
I have several family members that acquire diabetes later in life, which probably by diet and exercise would have been preventable, had they realized that the diet, that the Appalachian diet that we typically eat was causing such a thing, with all the high carbohydrates and fats, and the lack of regular exercise probably was preventable, which led to a lot of other medical problems. Complications, right. And as we're at work, we work with a lot of children who have diabetes. Which
Tell me a little bit about that. What are you seeing?
We work with the school nurses closely in Scioto County, and more, I used to be a school nurse. In '89, I had one child who was a diabetic for the 6 years that I was there. And now each of our school nurses has several diabetics in each building that they're working with, and the number just continues to go up.
And these are type 1 or type 2?
1. We're looking at type 1.
So we're seeing more incidents of type 1, you think?
I think so, yes.
And what about type 2? Are they being diagnosed? Or?
In children, I don't think we're seeing a whole lot. I probably really shouldn't answer that. I should probably let the school nurses talk about that, because I'm not seeing a whole lot. What I base my knowledge on probably is the number of kids that I get through the BCMH treatment program and that I talk with the school nurse about. So my numbers are probably not accurate.
Okay. Just in general in the community, and I know even you see kids come in to the clinic for various reasons. Are you seeing, in the last decade or so, are you seeing more overweight and obese children than previously?
Yes, I think we do. Yes.
But they're not being diagnosed?
I'm not sure. Not with diabetes. I'm not sure.
Okay. What do you think causes diabetes?
I think in a lot of cases, as we get older, we just have so many carbohydrates, and it just kind of wears out the pancreas from fatty liver and those kind of things.
Do you think there's some risk factors that we could do something about?
Oh, absolutely.
Could you talk a little bit about that?
Well, I think we need to be re-taught. I mean, it's a cultural thing, of course, in Appalachia. The kind of food I grew up on, which we always thought was healthy, is not. So people need to be retaught what healthy food is. And I think the new plate, I like that. I think that's a good, easy picture to understand how much of what you need to eat. And in talking with my own children, my daughter especially, I know she doesn't really eat a well-balanced diet. I look at her meals, she'll kill me for saying this, but it's just a large number of carbohydrates.
Yeah.
And I just think we need to be retaught. I think part of it's a lack of knowledge, part of it's probably convenience. I know there's times when I had my kids at home that we ate wrong just because it was fast and convenient. And I think that's part of it too.
Describe the new plate.
Instead of the food pyramid, I like the way that they have the food servings divided on a plate. That's a little more visual, or a lot more visual. I think that's where you eat, is on a plate, and it's easier to see what portion of your plate should be vegetables, what portion should be meat, and I think that's a lot easier for people to be able to internalize and be able to mimic.
How many servings of, or how much of the plate should be fruit and vegetables?
It seems like it was around 6. I think they raised the servings. I can't remember the number.
But
It's large.
it's more fruits and vegetables than
Right.
it used to be. Yeah. What do you think a person needs to do to keep diabetes under control?
I think we just need to eat healthier. And I myself have been, a doctor told me I was starting to get high cholesterol and such, that I should start eating more towards a Mediterranean kind of diet, which is higher in your whole grains and fruits and vegetables, smaller portions of meat, more fish. And that's really not a typical diet here in Appalachia, I don't think.
Mm-hmm. Mm-hmm.
So I just think that the diet and the exercise are probably
Okay, so let's talk about the exercise.
okay.
What?
Okay.
Let's not call it exercise. Let's just call it active.
Okay.
Activity, or
Yeah.
active lifestyle. What are you seeing here locally?
I see more people walking and riding bikes than I used to. I'm not sure if that's for exercise or because of the economy or
Mhm.
what, but I do see more people
Mhm.
walking around town.
Now, do you live here in
Than I used to.
Portsmouth or
No, I live out in the county.
Memphis?
The West Portsmouth.
West
area.
Portsmouth,
West
okay.
Portsmouth, Northwest.
So are they riding the bikes out there, or do you see them riding
I
bikes
see
here in town?
In town. I
You do see
more
them riding.
I see more people. I notice that riding bikes in town.
Okay. Well, that's a good thing.
Mhm.
Do you see people being active in other ways?
I don't notice if they are. They probably are, but I'm probably not noticing that.
Yeah, yeah. In your workplace, do you have an elevator?
Yes, we do.
Do you have a stairwell?
Yes.
And do most people take the elevator or the stairs?
It's a pretty good mix. I think that when I do see people get on the elevators, I've recently had some problems with my foot and had to use the elevator. Everybody always says, I usually take the stairs. And it's like they're aware, but we do see people walking
So
up and down the
you're seeing a
stairs.
little bit of a consciousness about it.
Yes.
Okay, that's a good thing. It takes a long time to get people aware that we could take the stairs.
Yeah.
And it would be better for us. What do you think are the most important things a person that has diabetes needs to do to control the disease?
The most important thing,
Mm-hmm.
probably the diet, or a balance of the diet and the activity.
And that's also kind of the hardest thing.
Yeah.
For people to do. Very often, people tell me they haven't really had good education about what to do or how to do. What's your experience with people in the community that have had the disease for a while? Do they know how to take care of themselves?
I think not. The people I've talked to personally, and just friends and neighbors, it seems like they don't understand the diet, because what was healthy, like a bowl of beans and cornbread, would be a meal. It's not typically what you would want to eat as far as a balanced diet. So I think it's kind of confusing sometimes to them. I think the diet.
And of course, then there's the problem if you've had the disease for 25 years, things have changed too. The rules about the diet even have changed. It's kind of interesting. I always talk about diabetes as a family disease, so that if one person had it, it really is about the family roles and interactions, routines. What do you see in families where a person has the disease?
It seems like if the whole family doesn't eat the type of diet that the diabetic should eat, which is really a healthy diet, that it's difficult for the diabetic to stay on track. That's what I see. Because food means a lot of different things to a lot of people. It's a comfort, it's a social thing, and it's difficult. I find it very difficult to say no to a blizzard when everybody in the office is having one. That's our weakness.
Yeah, well, I mean, that's natural though, isn't it?
It's stress eating. And it's very difficult if the whole family doesn't become mentally a diabetic and eat and do those things with the person to support him. It's tough. I've always said it was one of the most difficult diseases I think I would want to deal with.
It seems that the patterns of activity are similar as well. you know, if one person needs to be more active and everybody's just sitting, it seems hard to get the whole family going.
Yes.
Any ideas about that, or anything that you're...
Yeah, just as prevention, just for health, I know in our family there's several of us that walk, and that's mostly our form of exercise is to walk. And I don't think I've ever done it alone. If I call and nobody wants to walk, I don't go out and do it. I do have a treadmill, I might get on it, but I don't go and walk unless I have a partner. So you do need that.
So that partner is really essential.
To me it is.
Mm-hmm.
To me
Yeah,
it is.
yeah, I can definitely understand that. So what do you think then are the best things that family or neighbors, friends can do to support someone that has diabetes?
I think more community places where people could exercise, and just walking to me is a good relaxing form of exercise, of activity, because it's not really stressful. And if there were more community places and walkways and bike paths and things like that, my daughter's in Athens now in school, and she loves to ride her bike along the trails, and there's just the community, there's places where you can feel safe to do that kind of thing, and it kind of pulls you out even when there may not be someone there to do it with you as far as activity. And with food, gosh, that's a tough one. That's really a tough one.
Yeah, well, it's tough because the grocery store is full of products that really are not healthy. There's more to buy that's not necessarily the most healthy food.
Yeah. And it's so individualized, I guess. It depends on why you're not eating healthy, whether it's convenience, a lack of knowledge, a lack of money, or what the reason is.
One other thing I'm hearing people say is that sometimes it's about planning. We don't take time to plan what we're doing or what we're going to fix. It's sort of the spur of the moment. You work. What happens in your household?
Yeah, you're so right. I can remember my mother telling me that when we were in high school, of course we weren't as busy either, because I think all they had back then was maybe football for boys. There wasn't a lot of sports to get into, but she would sit down on Sunday and let us help her plan the meals, she said, for the week, and shop accordingly. But I can't tell you how many times I come home at 7 or 8 o'clock and hope to thaw something and cook something quickly instead of driving through Wendy's, and it's never successful. It's not healthy. So you're right. There wasn't. And even though I knew better, probably wasn't a real good, there was a lot more that could have been that in just planning meals.
Yeah, it's really kind of an interesting thing. We've changed so much in our society in the last 2 or 3 decades, really. What things in the neighborhood or the larger community do you think cause risks for diabetes?
In the neighborhood or the community that cause risks for diabetes? I can't really think of anything in particular other than just our just our overall culture, the way we've been raised and the way we...
Well, one of the things that usually comes to my mind is the idea of the automobile. You know, the automobile is a great thing, but we tend to drive sometimes unnecessarily, or the fact that we have to drive most every place we go. You know, so that kind of limits what we do in exercise or activity.
Yeah, and that's probably part of the time factor too. I bet we're too busy to take the time to walk.
Like I was running late.
Yeah, I lived 2 blocks away. I could have walked down here, but I drove.
Yeah. So I mean, you know, and so we tried to save the time, and we get in the car and go a very short distance sometimes.
I always feel like I'm in a hurry. I always have my kids in programs, in sports programs, and athletics. I always felt like I was doing such a good thing, keeping them busy. But in the end, we spent so many evenings unable to eat right. I wonder sometimes if it balanced, if it was a good idea.
Yeah, you kind of you forfeit one for the good of the other. So getting that balance seems to be a real challenge.
We feel like we're neglecting them if we don't let them play all the sports and do tumbling and do everything that will keep them healthy.
If you were, knowing what you know now, if you could do it again, what would you change?
I wouldn't let them do so much. I really wouldn't. I felt like I had to, or they were going to be left behind. But looking back, I should have known better, because we played ball in the yard and we did a lot of things that kept us a lot more active than they have been.
Mm-hmm.
I think it stressed them a lot more than it needed to too.
And so, years ago, families did more things together.
Right.
And now we transport this kid here and that kid there,
Yeah.
but we're not really ever doing things together.
Right.
You know?
Yeah, someone takes off with this kid to this practice and this child to that practice, and then you meet back at home at 8 or 9 and try to get homework and eat something and go to bed. So it's, I'm not sure.
Maybe we just need to simplify our lives a little bit.
I think we do.
That might make a difference for us. How involved are you with the local schools in the county?
We are pretty involved with our school nurses. We work with them regarding our children on BCMH. We help them do their scoliosis screenings. There's 2 times a year we bring them together and have a school nurse meeting.
Mm-hmm.
That's something Patty Staker started a long time ago, the previous director, and I plan to continue doing that. We talk with them all the time.
And what are the kinds of concerns that you're seeing in school children themselves? You did mention that you are seeing more overweight.
Yes, as we do the health screenings, help them with the scoliosis screenings, I've noticed that there are a lot more children who are overweight.
And is there any way that you're sort of sending messages home to the families that this is a health concern, that being overweight is a health risk?
As the health department, no, we're not. As a county health nurse, we're not doing that kind of thing. Not an organized effort in the schools.
So chances are then parents really aren't getting a message that the child's weight is putting them at risk for...
Probably not formally, not through us.
Mm-hmm.
As far as, the school nurses checking BMIs and things like that, I know they're starting to do those things, which is bringing attention to it. But the health department's not been involved in
that. I keep trying to think about this idea as sort of a child health prescription, so that's not about medicine. It's about eating more vegetables and fruits and having a prescription for you need 30 minutes of activity every day. People tell me that sometimes parents are rather defensive, and so the folks hesitate to say anything or do anything. But at the same time, I keep hearing these stories about children who, like someone told me this the other day about a 6-year-old that when they weighed, the child was 200 pounds. And that's terrible health risk and hard to change. Is doing that kind of thing something that the health department could get involved with, or is that in working with school nurses? Or
I would think we could. I would think it would be, it's important enough that we could.
And finding some way to make it sensitive so that you're not being necessarily accusatory or offensive to people, but just helping them see they need to take some action. Yeah.
That's a good idea. I'm not sure how you do it, but it is something that needs to be done.
We'll get Sharon Carver involved in that.
That will work. There we go.
Figure out how we can do that.
Yeah.
Do you think there's some things that the local schools can do to prevent diabetes?
Well, I hate to point a finger, but when my oldest son was little, he ate such good food until he went to school, and he no longer liked a piece of poached fish or he liked fish sticks. He started getting into the deep fried foods, and I think the school menus, when I look at the menus, they haven't changed much. And I think if there was a way financially, I think they could do a lot. They say the kids won't eat some of those good foods that they put out there, but I don't know. What's the guy's name that comes in on?
Jamie Oliver.
Yes, I've watched several of those shows, and I think that that's not a bad idea to tear that apart and give the kids a chance to try some healthier foods. I mean, I look at those little chicken nuggets, the greasy, deep fried, the frozen ones, and I think, when you take those and cut them up and cook them, without all the breading and just saute them in a pan, they're good.
Mm-hmm.
And maybe the others are better, and maybe they're quicker and easier, but they can't be cheaper,
Mm-hmm.
and they're certainly not as good for you. That's why I always tell my kids, you can't have pizza every night. It's your favorite food, but you can't always have it. Sometimes you have to eat other things. You can have pizza now and then.
Mm-hmm.
So maybe we could teach the kids through
Mm-hmm.
school to have some healthier choices. And I know that's not a new issue. That's something that's been discussed for
Right.
many, many, many years.
Yeah, but to keep discussing it and not
Yes.
changing it's
Right.
kind of a concern as well. How to do that just a little bit differently.
And I know they want to take out the vending machines with unhealthy foods, but do they replace them with some healthy choices? Because maybe if kids would try those things, they would, if they had nothing else and they were hungry, they might find they like them.
Mm-hmm. A lot of folks are saying that if you give the children fruit, they actually enjoy it.
Yeah.
And often they are not introduced to some things at home. So the school is
Yeah.
Are any of the schools here in the county doing community gardens?
I don't know if the schools are or not. I haven't heard.
Okay. What about? Are you hearing anything about community gardens?
Yeah, I am. In the city, I'm hearing some.
Some discussion.
We had some nice, back in the 80s, I did a block grant when I was at Northwest, and it was about nutrition. And we went into the classrooms and taught the kids, and we made some healthy snacks, and the kids ate them and liked them and took the recipes home, and it ended up being the end of it. It was just a one-time thing, but it did go over well, and the healthy foods were accepted by the kids. That was a long time ago.
It's really interesting that some of the things that maybe help children more than we realize, like physical education classes and home economic classes or family life or whatever we call it, are gone.
Right.
And so many young people and young families really don't know how to budget. They don't know how to plan. They don't know how to cook. So we really are causing people to not. Almost in a generation, we've lost some of those important skills.
Yes, yeah. There's a lot of healthy tips that kids would probably like to have, just simple stuff like using something else besides butter and popcorn, just little things like that that kids don't think of. And they could offer power walking classes as PE is not a requirement after a certain age. Then they could offer courses like that for kids who just wanted to stay in shape. Didn't want an after-school sport or something competitive.
Well, we're, as a nation, we're turning into this leisure society, so a few people do the work and the rest of us watch.
That's right.
So
and pay to watch.
and for young kids in school, a lot of times they if you don't make the team, then you're just a spectator.
That's right. I think we've lost sight of what the athletic program in school should be. There should be some classes that kids could take just for health, something that's not competitive.
Just for fun.
Just for fun.
Yeah.
Just to stay healthy.
Yeah. And, years ago, families played games together. I mean, maybe baseball or competed in the with your neighbors. You would have some folks have told me, too, about churches competing, having teams where they compete. Did you have any experience like that when you were growing up?
We had a couple of fields we just played. We didn't have churches and organized. It was just the kids in the neighborhood. And we all played. There were 2 places where we met in the field and just played ball all the time.
Now they just text each other. And
Text each other about something else, yeah. Our phones are in good shape.
It's kind of interesting, isn't it? What do you think the most important thing is that people need to know about diabetes?
I still just think that people need to know that it's on the rise and it's preventable. In many cases, it's preventable.
So then how do we get the word out? How do we begin to give this information out in the community?
I don't know. That's a hard one because still I think whenever you say that, people think, not me. I mean, I was probably headed down that path myself because it's the way I ate. But I've turned that around. But I don't think everybody realizes that it can happen to them on their next doctor visit, Yeah.
And what we know from research is that it's often a person often has the disease 5 or 6 years before they actually get that diagnosis.
Right.
So we need to get people thinking about it much sooner.
Yes, and I'm not sure how to do that.
If you could change something in your workplace, because you have your employees and you have a large variety of people from the community coming in and out for various reasons. What kind of thing might you be able to do to make it healthier?
You know, the idea of taking those stairs and walking, or maybe giving people a 10 to 15 minute break to walk around. I know some of the people do walk up and down the stairs and around the floor after lunch just to take a short break. But to actually put that word out there and encourage people to do it, that's probably something, because sometimes you just need to be reminded. You start doing it and then you get out of the habit of doing it.
And encourage people to do it with somebody else too, and to get a partner. One of the things I always find so interesting is that nurses know what we should do. We know, but then actually getting to do it is a big thing, a big problem.
There needs to be a motivator in each group. Somebody to keep us motivated. And it seems like so many times that you start and then that person backs off or leaves or whatever, and the motivation's gone and everybody falls back into their old habits.
Have you given any thought or heard some discussion around the idea of health coaches?
Health coaches, that's a new...
You haven't heard about that?
No.
Okay, so the CDC is really encouraging this idea of health coaches, and these are lay people that we train to go out and be supportive and just encourage and teach some basic information, not to be care providers and provide primary care, but to just to be able to give some messages out and give support to people. And you haven't heard anything
at a
about
community level, you mean, or
at
individual?
community level.
Okay. Okay.
So that working with chronic disease. So, for instance, the prevention of diabetes is the same things that would prevent heart disease and strokes and hypertension and so giving those health prescriptions kind of. So giving people some basic education to become what's called a health coach.
I haven't heard of that word. I haven't heard
Okay,
of that term.
We may need to work with you a little bit around that and see if there's a way we can do something in this community. I can share more with you about that at another time. I think I've covered most of the questions that I really wanted to cover with you, Ruth. Is there anything else about diabetes or health or concerns that you'd like to share?
On a personal note, I would just like to say to anybody that's trying to make a change that it's not something you can wake up and just do tomorrow, that it takes time. On a personal level, I've been trying to change the way I eat. Like I said, a doctor had mentioned the Mediterranean diet. And it's kind of funny because I talked to a dietitian and they didn't really know what it was, so I started looking in books and reading about the kind of foods. And it's taken me 3 years to be able to look in my pantry and pull things together and make a meal without a recipe, like I could have in the old way I ate. I could have come in and looked in my fridge and pulled things together and come up with something that was probably unhealthy, but it's a lifestyle change. It's not eating, it's a lifestyle change, and you can't change your lifestyle overnight. So for anybody who's trying to make change, I would like to say be patient, and small steps, I think, are very important. Small steps.
Absolutely. And I think sometimes we see the big goal, and we're better to kind of plan some stops along the way that we can measure it.
Yeah. The first thing I did was I stopped eating bacon every Sunday because I decided that was too often. So there are really just a lot of small steps you can take, and it does take some time to do that. Otherwise, I think you lose motivation.
And sometimes if you can give up the bacon, then after a while it's like, well, really don't even need it.
No. Well, you need it once in the summer with tomato.
Right.
You got to have some reward.
Exactly.
No.
Well, thank you so much.